The Omicron triggered third wave is clearly here in India, but is it all bad news or is there some silver lining in the clouds? I'm Barkha Dutt, you're with the Mojo Story. Let's introduce the key developments in this unfolding story. We know now that the Omicron variant, the seventh such variant of the COVID virus, is clearly in community transmission in India, like in other parts of the world. Although it is galloping at a breakneck speed, with even in Delhi, for example, more than 80% of samples that have been tested for genome sequencing confirmed to be of the Omicron variant, the news is not all bad. A majority of cases in the major cities of India continue to be asymptomatic, and there has so far been no pressure on the ICU system. But given the new variant and its galloping breakneck speed of transmission, do we need new protocols? We'll be talking today to JP Mulyal, one of the country's foremost epidemiologists, also a member of the COVID advisory body that has been advising the government on framing policy and making interventions. It's good to talk to you in the new year. A happy new year, and maybe may it be a better year for our country. Mr. Mulyal, it's a pleasure to have you back on the program. Let me start by asking you how worried you are today. It's quite clear that Omicron is in community transmission. The bulk of samples coming back from the genome sequencing labs are being tested and confirmed to be the Omicron variant, and it clearly is in community transmission. How worried are you? How worried should we be?
Well, let me start with how worried I was, because I was quite confident a big wave like that is very unlikely. But when things started going bad in South Africa, it was a shock. And after Delta, cannot trust this virus anymore. But as it turned out, even though it has some ability to uh, break through and come in as an infection, it is actually a very gentle virus. And that was very obvious from not only in South Africa, but in European countries too. So there's a big difference between this and the preceding viruses. Whereas this one is extremely infectious, the clinical outlook is brilliant. For example, if you think of a spectrum, and at the left end of the spectrum, you put subclinical, and at the right end of the spectrum, you get very serious cases. The spectrum seems to have moved toward the left considerably. So it is a mild disease. It also invokes immunity, and it is not going to be a public health crisis at all.
It is not going to be a public health crisis. You're confident.
That's right.
Let me
And
let obviously I bow to your better judgment, but let me just push you with some of the questions that I know our audience will have. You say it is a mild virus, and clearly looking at what's happening with ICU beds and hospitalization, that's holding true for India just as it did for South Africa and the United Kingdom. But there is one argument that because it is so infectious, even if a small number of people end up in hospital, our health system cannot take it. And if that small number hits our healthcare workers, our healthcare system will collapse. These are the two main concerns at this point. How do you respond to that?
exactly. And that is what the worry I had early on. And I said I was initially worried. But as this picture unfolded, and it was very clear, the mildness. Now, I'm not going to argue this particular virus is a gentleman by nature. It so happens it arrived in the scene after several of the waves are gone through, people have been immunized. So I guess the virus had no option but to behave itself. So that is one possibility. When it's an interaction between virus and a human body, and both have a little to say on a bit to say in these matters. But unlike in the case of Delta, which was quite nasty virus, this one is coming along quite nicely. And the early signs are very, very promising. And we have to really be careful about it. But I think this is not going to trouble us seriously.
What about the healthcare workers? The one thing the public health system cannot afford is to have, let's say, 30% of its doctors isolating at home because they've tested positive for Omicron, whether they're symptomatic or asymptomatic. And I'll get to testing protocols in a moment from now. But given that it doesn't seem to be causing virulent disease, even so, if 10 days of isolation is mandatory, you could have a section of your healthcare workers, if infected in large numbers, knocked out of the system.
Barka, the problem is we all are ill with the coronaphobia. We are scared of the virus. And this particular isolation business is no more needed. It was not needed for a long time because the initial thrust was on getting rid of the virus, stopping it in its entry into India. We couldn't do it. Then we'll say we'll contain it. We couldn't do it. This is too infectious. And the one that followed Delta was even more infectious. So these infectious diseases, you can wish all you like to stop it. It can't. So these exercises that we go through, isolation, whatever the techniques we use, quarantine, nothing work. The thing is, it is worthwhile giving it a shot if it's a dangerous disease. Now that we know it hardly matters, I think the balance of things suggests that you just take care of the people who are frail, very elderly, immunosuppressed. They have probably the only thing they can do is to make sure they wear a double mask. The rest of the population, I would say, things are cool.
That's very, very promising. And I think it's just the kind of New Year news that a lot of people would have liked. But even so, I'm not going to stop with some counter questions, Mr. Mulyal. And let me start with the first one. The first question is, testing. During Delta and the first wave, there was a belief that you needed to test more and more and more and more. Given that prima facie Omicron seems to be, as you said, mild, especially for the vaccinated, would you say that if let's say you and I have no symptoms, should we be testing? Should the asymptomatic be testing?
There is a disease called COVID related pneumonia to be managed in a good center with all the facilities. Those physicians would like to know if it's corona or not. We don't need to know every cold, every sneeze, is it due to corona? There's no point knowing. Okay, it's there all over the place. So be comfortable about that and say, don't test unnecessarily. Let doctors, when they need to look after patient in a hospital situation, let them test. Okay. Now, luckily, the whole world is involved in it. So even the testing in the aeroplane, all those things are just an exercise in futility. So where we go to it, that understand the virus. It is harmless as of now. Not for everybody, I agree. And those people have to take special precaution for themselves. That's the way to go.
You're saying something very important. You're saying that if, let's say, a patient is admitted to a hospital, maybe sometimes even for something else, a hospital or a treating physician can decide whether they need to be tested for Omicron. But routine, random, mandatory testing is no longer necessary, especially if you have no symptoms, not even if you have, let's say, a mild cold. Not necessary.
Yes. And one thing is that certain centers in the country should be earmarked to monitor and sequence these viruses and know where we are going. That is a different story. But don't give this testing as a weapon in the hands of the public health people. They don't need it. You can take for granted in a little while 100% the virus isolated as corona will be Omicron. So there's no fun in gathering any more sequencing data. Okay, it's rapidly replacing Delta.
You're saying just assume Omicron is here. It's going to be 100% soon of the cases. Testing and isolating no longer has any meaning.
That's right. I said it will be affect. I didn't say it will affect 100% of the people. I said 100% of the positivity
Cases.
will be
Yes.
cases will be Omicron, and
Yes.
the good thing is it will replace Delta completely.
Yes. Now, sir, you advise the government, you're a member of the high level technical body that does. Is the government prepared to accept this? And I ask this because certain very archaic 2020 measures are still being followed. For example, institutional quarantine. I recently interviewed a lady who came back from France who was taken to hospital against her will. She had no symptoms. So, can you not urge the government to have a rethink on all of these things?
Well, when I see the government, I'm surely going to talk to the guy. Now, who is the government? I mean, we all have to collectively make a decision as to how we approach the problem. Now, the point is that we have got certain methods taught to us from the early days of Corona. Somehow keep the virus suppressed for what we have not been told. This is the mantra that we meted out with. You know the old saying, if a hammer is the only instrument you have, everything in the world begins to look like a nail. So you just have to repeat the same step, however useless they are. So most COVID infections under the sign of Omicron don't require treatment, don't require hospitalization, and if some of them do require any testing because they have pneumonia-like symptoms, then let the doctors decide. Now, I know in general practice, many people would like to have a little more excitement so that the practice become looks good. You look after this virus positive people. Virus positivity is not a disease anymore. You can forget about it. There is no question of eradicating virus. It will do its job, and we can't do much about it. So unnecessary testing and isolation, quarantine, all these are really wasteful exercises.
So, for the most part, you would urge those who have no symptoms to not bother testing.
Yes, no symptoms or mild symptom. Do not test yourself. Take it as a cold. It may be Omicron. Doesn't matter. I mean, you'll be all right. Remember, in India's population, mostly are previously infected. On top of that, we have given more than a crore, 100 crores of vaccine. Now, we should trust in our ability to defend ourselves now. Otherwise, it is not fair on the people of India.
But what about the fact that we are still seeing very, very ignorant old measures? We are seeing buildings, residential buildings being sealed. We are seeing schools back to being closed. We are seeing that idiotic move of night curfews. We are seeing 50% restaurant capacity. We are seeing gymnasiums and entertainment parks being closed. Why are we back to the future, so to speak?
I know. I, I met my friend who was riding a bike without a helmet, which is wrong. I agree, but he had an RT-PCR done. You understand? So we can't explain many of these mysterious kind of interferences, and everybody is very anxious to do something. So the traffic policeman does something, and everybody has to contribute. It's all done in good faith, but some leadership should be able to clearly bring down saying things are over, we are in clear waters. Omicron is not going to hurt us. And what else to say?
There are those, Mr. Mulyal, who might say that you're being a little cavalier. They say that to me sometimes, even though I have had COVID during Delta. My father died from COVID, so it's not that one is being cavalier, but life does have to find a way of going on, and we have to listen to the science. But the science also tells you the unvaccinated could be at risk from Omicron. Our vaccination numbers so far do not cover a large bulk of our population, which is those people under 18. We have only as of the 3rd of January, started our 15 to 18 getting vaccines. Why are you not concerned about the impact of Omicron on the unvaccinated?
The reason is this, that I have a feeling from the numbers we see after zero survey and the delay we had in getting the vaccine going. Almost 90% of the population have, in the tested population, have been um, infected. So you see, then not infected, not vaccinated, that proportion is likely to be extremely small. And in that group will be a lot of elderly, I agree, who are the ones who are scared of all. So that's why I said in the beginning, for their sake, the best method is not to force them to have vaccination because they are scared. Maybe we should encourage them to at least be isolate them for a little while because and wear mask, because this wave, like South Africa is an example to go by, will last only a short period of time.
Now, this sort of a belief that previous infection was going to protect us was something we believed even before the Delta wave. But the Delta variant, played out quite differently as we saw. Do you believe that boosters are the way out, or are the science is divided even on those where boosters have begun, yet the Serum Institute at least confirms that there have been no fresh orders. There has been some controversy today among users that some of the vaccines that have been given have are beyond their expiry dates, because as we know, some of the vaccines have been lying unused in the private sector. How much of this concerns
That's what I'm saying. As a nation, I'm not looking at individuals. We are in a pretty good shape. Now, 90% infected, 140 crores vaccinated. Not for the same, everybody, some got 3 doses and things like that. That's okay. But that is not a small performance. We should congratulate ourselves. Okay? So, you raise the problem that are still unvaccinated, at least give them one shot. Yes, I agree with you. And all that is fine. But look at on the whole, compare with 2019, when we are naive immunologically, how better we are for a new variant. And early indications tell you that we are in good shape from all the experience so far. Not only with
do
us, other
yeah.
countries too.
Do you believe that we are making an old mistake by not ordering enough vaccines? We do have some new vaccines now approved. There's Corbovax, developed at the Texas Children's Hospital by Peter Hotez. It's a not for profit, not patented vaccine. I had a chance to interview Mr. Hotez, but some questions are being raised in India about what we know about the efficacy of this vaccine. Do we have enough knowledge to have given it approval? Could you shed some light?
This vaccine, I have not much experience, but I like the idea it was done in such a way that profit was not the primary motive. I mean, it's a rare commodity to find in the world these days, and I appreciate that. I wish we had got it a little earlier. That's all I can say. But just because there is an extra vaccine, giving them is not the right approach. But the technology, and it's important that we imbibe, and any future, yeah. See, don't think this will be the last variant of virus that attacks us. Things will happen again. We should look back critically at what happened and follow the thing that don't let it happen again. If I were to tell you more people died during corona lockdown than because of corona for other reasons, should not repeat that. Okay, so a lot of disruptions we caused in the past. So the vaccine is good, but in terms of saying, let's now get this vaccine and give it to everybody, maybe that is not the appropriate time because of the densely immune population that has evolved in India by chance alone. I mean, got
That means
infected.
you're counting, that means you're counting as you have from the first wave on herd immunity. Is that not a dangerous argument given what we saw happen with the second wave, one? And secondly, an infection is not the same as a vaccine. I mean, we're not telling people go out and get infected, you'll be safe, because the more the number of infections, the greater the chance of a mutation and the greater the chance of a new variant. And as you've said, Omicron is the seventh variant, it won't be the last. We don't know that the next variant will be kind or mild to us as Omicron seems to be.
The when the Delta came around, certain parts of India were completely spared. These are the areas where there was dense infection, like Dharavi like areas, very, and hardly any waves there. And the total protected people immunologically was only 24% when Delta stepped in. The scene is completely different. So, and in fact, studies show how good a natural immunity is and that it lasts long. Now, that doesn't say the vaccine is not relevant. It's extremely important. And we could have saved many lives if we had vaccine right away. All I'm saying is, with corona, the technology related to vaccine blossomed and things can happen much more faster than ever. So world is better prepared. Talking about this particular vaccine you pointed out, and I'm impressed with their courage with which they came forward and the graciousness which they offered it to the world. And it's a rare phenomenon nowadays. Now, given that, if your question is worded, should we take the vaccine and give it to everybody? Now, that is a programmatic issue. I don't think that is the priority now because it doesn't, that has to be done from a different format, now not in the context of Omicron.
Okay, I want to go back to something you said. You very clearly said the asymptomatic or mildly, if you have a sneeze, don't go rushing to test. But, some doctors have suggested that the treatment for Omicron and Delta is quite different. For example, monoclonal antibodies are not working on Omicron, that you do need genome sequencing to know how many are Omicron and how many are Delta. You're saying it doesn't matter. You're saying it doesn't matter. We don't need to know.
What I am trying to say, majority of the patient, I told you about a move in the spectrum to the left. Most of them will take care of it themselves without the help of doctors. But a small percentage, and in fact, I think it will be less than, very, very small minority. I can't even put a percentage on it. And this will be elderly with comorbidities who have not had vaccination. And those people will have problems even if it's Omicron. Even though it's a gentle virus, you're asking for trouble if you're opening up yourself. Now, encourage people to vaccinate even at the age of 70, 80. That is one rule. I'm not going to deny it. But these kind of therapies where people are unable to fight the disease and require immunotherapy, that is going to be rare phenomena which will be happen to be taken care of in the hospital. For that sake, no doctor can say, please come to hospital early once you're diagnosed positive for RT-PCR. Negative. No way.
That's such an important point. I've been saying the government needs to communicate very clearly that even if you test positive, please do not come to hospital. Because if more and more people start coming to hospital, that is what will, topple the capacity of the healthcare system.
I do agree with you. And actually, the problem is that it is also sometimes it is a economically a very welcome move for some hospital, when people rush to the hospital, which should not be in the interest of the public at all. Anyway, I think education is of two kinds. We educated them about vaccination. Now we should say this particular virus is when you are mild, nothing to worry about. Positive test. And that's the reason why, random testing or indiscriminate testing, which some people want to happen, is a waste of energy and adds to the confusion.
What about children? Our schools are closed again. We've had among the world's longest physical shutdowns of school with great disrepair to our children. And where schools do try and open, parents simply refuse to send their children to school. And the fact is that even if children recover from disease faster, the argument is made again and again about them being vectors. How do we get parents, governments to open schools?
We have been struggling to do that. And see, the problem is very often emotions get entangled with scientific matter. And, in the name of protecting children, we actually are stymieing their development, and it is quite, and many people don't realize keeping children home is not good for their development when there is no need to do so. Anyway, I mean, this is where I have spoken about it several times in several forums, and I think we need to keep saying that investment in future is education, and we have hit at the many parts of our education, including medical education, engineering education, which is sad. And I think now at least we should say, forget it. And the how well children have dealt with this whole COVID experience brilliantly. Okay, nothing happened. The quoted mortality from many countries is less than 0 per 100,000. So, given that kind of a track record, and you remember the exponential curve we drew for mortality against from age, and it bears across the ages that as you go older and older, you have an exponential rise in the mortality. And that fits in with the natural history of the disease and the biology which works behind it.
But
So,
children may do pretty well, but they can carry the disease home to the elders in their home. Also in India, 92 million households live in homes that are one room homes. So you have 7 to 8 people living in the same room. So children can do well, but they can take it back to their grandparents, for example. So is it not important for children to be vaccinated as well?
the point is this. In fact, I'm going to start by saying it is not important from the point of controlling transmission because vaccination, unfortunately, doesn't prevent transmission. On the other hand, natural infection does it to a much better extent. Now, in India, children got infected almost close to the same level as adults. Okay, so and how did they do? Well, brave it fantastically. Hardly anybody had problem. We lost a few children, but all of them had some very significant comorbidity. So I think we should be dispassionately look at this data and say children are fine. They can be taken care of. They know how to take care of themselves. So I am not worried about the children. Today, if you ask in India, should children be vaccinated? I suppose. I am not against vaccination. But there is one little thing you should remember. In the case of influenza, when you get natural infection, you have lifelong immunity. Okay? But vaccinated immunity lasts only about a year or two. Okay, now look at the analogy. I don't want to say corona works that way, but current evidence seems to suggest natural infection gives you very strong immunity. You must have seen the Israeli study, infection versus vaccination.
But
The
is but
protection
Israel is on its fourth vaccine, not even its third.
because majority of them are vaccinated citizens. Majority of them are vaccinated citizens. So India is different from that, and that is the reason we should be careful how we push the agenda in these sort of situations.
Mr. Mulil, what about Professor Mulil? What about long COVID. There's a lot that we don't know about it. People who have had COVID talk about post COVID fibrosis of the lungs, of hair fall, of brain fog, of memory loss. We don't have enough research, but I was reading that scientists are researching COVID now not as a respiratory virus, but as a neurological one, also looking for its impact on kidneys. Omicron, for example, we know is not hitting oxygen levels, just as an example. So the virus is also changing. And one of the problems is that even if the mortality in the hospitalizations is low, we do not know long COVID. We just don't know enough. Is that a matter of concern?
Now, there is a difference between reinfection and breakthrough infection, right? And in the case of an infected person who's already infected, the reinfection is extremely low. This is a point I want to say. Even after vaccination, people do get COVID 19. Okay? And quite a significant number of them. This is a worrying thing. Now, there's no evidence even now that vaccination will reduce long COVID. What we have evidence is that vaccination reduces severe disease, respiratory problem, and ICU admission and death. That I agree. Neurological problem, hair loss, I suppose any serious illness can cause hair loss. But I'm not saying we should not vaccinate. What I'm saying is when you look at India in retrospect, don't forget the fact there is a huge amount of naturally acquired immunity. There is a reluctance to talk about natural immunity in many quarters. In fact, World Health Organization refused to accept there is something called natural immunity for a long time, till they came out with the concession saying, yeah, it's as good as vaccine. It is not as good as vaccine. It's even better than vaccine. That is a reality. Okay.
But
So
that doesn't mean we're going out and telling people go get infected. That's not what we're
not at
saying. We're
all, not
saying
at all.
circumstantially a large part of our population may already have been infected and therefore have that shield. We're hoping.
And in the delay that we could produced, because the vaccine didn't come hit the Indian market early enough, large number got infected. We could have avoided that. That's all I agree. But now, in retrospect, what you say, 90% infected with naturally. Now, what are the priorities now? That is a research question. We have to look at it carefully and advise our people as to what line to say. It is not a question of emotional question or anything.
Okay, let me ask you in the end, therefore, where should the government's focus be? We take away from this conversation that it should not be on mindless testing. It should not be, certainly, even the old test and trace rules do not apply for a virus that's already in community transmission. It's meaningless. Schools should open. What is the one thing you would urge the government to do so that we are well prepared to protect our elderly, our frontline workers, and our immunocompromised sections of the population?
Well, it is a medical problem, and leave it to the medical department to look after if there is a serious case of pneumonia. It may be COVID, it may not. It is no more a disaster management area at all. Disaster management group worked hard. I agree with you. Now we need to have people have independence to do things. We go on doing this kind of restrictive kind of behavior. It's not good for the country. It's not good for the soul of the country, when you are restricted in this manner.
What
Now,
if a lot of doctors get infected?
this particular one is a mild one. I don't think there are many doctors who have not been vaccinated. They are unvaccinated. Most people will take. I'm vaccinated. I got the first opportunity, got a vaccination. That it is a sensible thing to do. But today, this particular virus is a much milder virus than before. You have to recognize it. And
So
in that context,
would you advise rethinking the old 10-day, 2-week isolation as well?
no, not at all. But don't worry, the isolation will not work because in majority of cases, Omicron is a subclinical infection, more subclinical than in the case of the original virus or Delta. So Whether you like it or not, it will spread. Okay. So the thing is, to avoid embarrassment, stops testing all over the place. Okay. You do test in hospital. Take care of them who require special COVID pneumonia management and forget the isolation. In my mind, okay, there are people who will say I'm talking like a mad person. That's fair enough. We did all this isolation, and what did Delta do to us? It ran all over us. And Omicron is a faster runner. So there's no way, whatever we do, we can block it. Recognize that. But does it hurt us? It will not.
Well, that is a good note to begin the working of this new year with. The Omicron headlines sound dismal, but there is JP Mulya, leading epidemiologist, telling us that the news is not all bad for very many reasons, including the fact that large sections of the Indian population have already been infected. And the better news might be that Omicron actually offers a shield against the Delta, which remains the much more virulent virus. JP Mulya, thank you. Have a happy 2022, and we'll be in touch very soon.
You
But for
too.
those of you who have not got vaccinated and have a chance to get your second jab or your first jab, please do get vaccinated. Vaccines still protect against severe disease and hospitalization, and that is not going away. That remains a scientific fact. Thank you for watching, and see you again soon. Goodbye.
Thank you.
It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.